Imagine, you just graduated from high school, you get a seemingly innocent back injury at work. You go get the injury checked out and are told you have a fist-sized tumor on your spine and need 10 months of something called chemotherapy to help doctors shrink and remove the tumor before it kills you. This is what happened in my case, and cases very similar to mine happen every day. Probably the most frightening subject was being told that I had to do chemotherapy. I, like most people, had a very minimal understanding of what chemo was and what it was supposed to do. So what is chemotherapy that everyone is so afraid of? I'm going to help you understand where chemotherapy originated, what is in the chemo, and the side effects that happen to the body. To start, I'm going to explain the origin of this brutal concoction. During World War II, mustard gas was a weapon being used, and the results of what it did to the body concluded that it was effectively decreasing the white blood cell counts in the victims that had inhaled the nitrogen mustard. According to Dr. Ananya Mandal from newsmedical.net, in the 1940s, two pharmacologists named Alfred Gilman and Louise Goodman started to test the toxins produced by the mustard gas to see if it was destroying rapidly dividing cells in the body, which would explain why the victims' white blood cell counts were so low and would also tell them if it had the ability to attack cancer cells. The first patient to receive the diluted nitrogen mustard called mustine was being treated for non-Hodgkin's lymphoma, and a study found that after injecting the mustine, the tumor was significantly reduced for a few weeks until more treatment was needed. The study was published in 1946 and marked the beginning of the use of light chemicals being used to fight cancer. This brings me to my next topic, which is what we find in the chemotherapy drugs that are given today. As time goes on, more and more types of cancer are being discovered, and the list of drugs that treat these cancers are moving steadily with them. There are many types of chemo and chemicals that are put into them. It all depends on what chemo doctors have found effective in shrinking and removing the specific type of tumor that you have. I'm going to use the drugs that I received because I know them the best. They call these deadly concoctions cocktails, which means that there are usually 2 or more chemicals in the same regimen. I had a 2-day regimen followed by a 5-day regimen with 2 weeks in between where I wasn't getting any injections. The 2-day regimen was known as VDC, each letter being an acronym for a drug inside of the cocktail. V was for vincristine, D for doxorubicin, and C for cyclophosphamide. The 5-day regimen was known as the IE regimen and had two drugs inside of it, one called ifosfamide and the other called etoposide. The 2 weeks in between was to give me time for my body to let my cells reproduce again. So those 2 weeks, my white blood cell counts were very, very low, and I would have to give myself 2, maybe even more weeks before I started my next chemo so that it wasn't dangerous for me to do it. The effects of chemo can be found in even the earliest exposure to the chemicals in World War II. Chemotherapy is extremely effective in attacking rapidly dividing cells. The reason why chemotherapy is so widely accepted is because it does indeed work. Not in all cases, but in some cases, like mine for example, the chemo was effective in removing the cancer cells from my body. However, it didn't come without a price. A lot of people think that cancer patients are sick because of the cancer itself, which is definitely true, but the ones getting treatment are significantly more sick than any because of the toxic effects that chemo has on your body. I was prescribed 4 different nausea medicines to combat one of these effects. This effect was called chemo brain. This makes you extremely drowsy and foggy, and it has similar effects to the worst hangover you could possibly imagine. I found while researching an article by sarcomahelp.org that most chemotherapy patients suffer from compromised immune systems. This is because the drugs and the chemo destroying your reproducing cells also include your white blood cells, which are the main fighters against diseases in your body. This makes patients very prone to any other illness because the body doesn't have the tools it needs to fight the viruses and bacteria that enter the body. This makes it extremely dangerous for cancer patients to be around children or anything else that carry a lot of bacteria. Another reproducing cell that chemo attacks is your hair follicles. This is why you see patients with no hair on their face, including the top of their head, their facial hair, their eyebrows, and even their eyelashes. These are all bad effects that it has on the body. But the one thing that chemotherapy does that makes it all worth it is it helps remove tumors and save lives, even if it does make you extremely sick in the process. The good news, all of these effects wear off after treatment is stopped. Going into my treatment, I was more afraid than I've been in my entire life because of not knowing what I was about to experience. I wouldn't want anyone else to go into it feeling like I did, and I hope that I have given you a better understanding of what patients have to go through by explaining where chemotherapy originated from, what is actually in the drug, and what it does to your body during the course of treatment.